It being the hour of 9 o'clock on Wednesday, December 15th, I would like to call to order the Human Services Committee. We call
I
it.
have Kevin also. Kevin works on boilers. That's why I'm here instead of there.
Lewis? Allen?
Allen, present.
Bates?
Bates here.
Davis?
Davis here.
Iqbal?
Iqbal present.
Kenyon? Pirog? Jepro? Sturgis?
And you called, I see Lewis online. Anita, are you here?
She didn't answer yes.
Okay.
Yeah, she's here.
I see her online. I just don't hear her, so. Okay, good morning. This has been a hurried morning for me and just for educational purposes. I received on my way here, fraud alerts going off of my credit card going nuts. And it seems that after calling Citibank, just when you think that your children are grown and out of your house, your credit card could be buried in one of their Apple wallets still. And when their Apple wallet gets hacked in Minneapolis, shuts down all of your stuff. And this has been one heck of a morning to scramble into this place. So I
Did you
apologize
fix it?
if I seem a little disheveled, but I thank you.
Is it fixed? Did you get it fixed?
It's wonderful to be a handful of days before Christmas, and we're going to turn off your card and mail you out new ones that you'll have in 48 hours. It's really conducive
Well,
to Christmas.
Merry
shop.
Christmas to somebody else.
Yeah, exactly. To the nice person in China who hacked, God bless you. So, okay, call to order. Approval of minutes. I believe we're going to defer those minutes are not prepared for the meeting. And everybody's busy. We get it. We'll come back to those the next meeting. Do we have anyone for public comment that's in-house or online? Seeing none, we're going to monthly financial reports that I believe are attached and online. Does anybody? Okay, perfect. Veterans Assistance Commission, we've asked Jake to abbreviate his report and just let us know if there's anything that's outside of tolerance, because we have some heavy items to get through this morning. Jake?
My report is in the agenda packet. Nothing is out of tolerance. I'd be happy to answer any questions you might have.
Appreciate you taking the elevator ride up, Jake. Thank you so much. And Jake, we recognized, is his name Steve?
Yes.
Yeah, last month at the committee level, and it was just an absolute joy to see you both represented yesterday. And I know we say often that we are truly, spoiled to have you in the leadership role that you have down there, and the level of professionalism and commitment that your team gives to our veterans is beyond reproach. And to just get that acknowledgement yesterday for a member of your team, can't say enough about it. I thank you so much.
We have a great team.
There you go.
We all agree. Congratulations.
Thank you. Okay. Jamie, I am going to ask you equally to abbreviate this report as much as we can, unless there's something outside of tolerance. If that's okay with you.
Yep, everything is normal, nothing outside of tolerance. So all the reports are in the packet. And if anyone has any questions, I'd be happy to answer them.
Does anybody have any questions for Jamie? Excellent. Thank you so very much. And again, this is outside of the norm. We have never done this before, but I think we have heavy items we need to get to, and I want to allow time. Compliance monthly training reports.
So that's just the sexual harassment reporting. We are down to only 5 individuals that need to complete it, who are all board members. So we just need everybody on the board to make sure they get their sexual harassment training done.
And just so we're clear, are you looking at the?
No, you're done, Cliff.
Yes. Okay, perfect. Perfect. As some of you may know, we have multiple companies, and I am derelict on one of them for my sexual harassment training. And I got the email yesterday. I was like, ouch. I'm sorry, Mavis.
Am I done?
Yes, you are.
Yay,
Okay.
Mavis.
Yay, woo!
There we go. Okay, Jamie, if you need anybody to make a push or a nudge on that, I'd be more than happy to do it, so. Okay, old business. Health Department analysis.
Pat Farah, the consultant that we've been working with on that health department analysis, is here to make a presentation to you on her final report.
Perfect. And admittedly, I have not, despite our best efforts, Pat and I were not able to get together before this meeting. So this is the very first I'm hearing of the report, and, you know, we are all ears.
And thank you very much. I'm at the very end of a cold, so if I start to hack, I may walk out and get my water. Thank you again for having me back. I'm gonna.
Pat, could we set the stage with this, that I would like you to explain as briefly and concisely as possible what your scope was
Mhm.
and what your goal was, so we understand where you're going with this outcome. Is that okay to ask?
Absolutely.
Okay, thanks.
Absolutely. The purpose of the project was really twofold, or maybe three. One was to get input from the staff on gaps in staffing, in services, in activity in the health department. The second was to identify some of the critical criteria for the executive director recruitment that's going to happen after the holidays. And I presented that to you last month, so you have an idea of what that was. And the third was just to get an overview of the potential workforce issues and areas that of productivity and workforce that could be improved.
Okay.
What I'm going to focus on today is kind of just the general overview as well as the staffing piece of it. There is a lot of detail and justification and backup in the report. I'm going to try and give you some of that as we go through, but if there's more detail that you want, then I give you as we walk through the report, walk through
At
the
the committee level,
PowerPoint.
I think we're looking more for flavor.
Mhm.
At the human services and executive level, they're probably looking more granular.
Okay.
Before you start, could you give us some idea, and Jamie, help out if you can? How many people are we talking about in that department?
58 right now, and I think they have 5 or 6 vacancies, something like that.
Okay,
And that was one of the things that did come out in my interviews with the staff. About 10 years ago, there was a major reorganization of the health department, and at that time, it was almost twice the size.
okay.
So there was a significant cutback, and a lot of the services that were offered by the health department were then contracted out to other organizations. So that was a
Were you able
significant
to
change.
identify with that, to begin the analysis, the scope of work that's required or mandated by the department? So when we say it was cut back from, and I'm just using numbers, from 100 people to 50 people,
Mhm.
I'm assuming we outsourced some of that workload. But we live in a world where Springfield, for instance, might say, you have to do this,
Mhm.
but it's unfunded mandate.
Mhm.
Does the department, in your opinion, is the department meeting the essential needs that it was charged with? And we're ready for expansion, or are we just treading water?
The department is performing all the required
Okay.
functions of the health department.
Got it.
But that doesn't mean that they're doing it efficiently or to the capacity that might be needed given the needs of the community. And that was identified in the report. Much of the activity that happens that's outside of the mandated requirements, like restaurant inspections and things that are outside of that, are grant funded. And so those things happen because someone saw a need and identified a grant to support those activities. One of the things that came up in my interviews was that isn't a stable way to provide services, to rely only on the grant funding. So that was an issue that came up. Okay, I'm going to go to the first one. So I want to just give you a little bit of flavor for what I did in preparation for the project. So I met with the leadership team of the health department to talk through what I would be doing, to have them review the questions I would be asking every staff member, and then to give me input on what might be some stumbling blocks, what might be areas that I needed to be concerned about as I went into those interviews. One of the things I mentioned, the reduction in force and the reorganization that happened 10 years ago, that's still really prevalent in the minds of a lot of the longtime employees. So it was suggested that I have an all-staff meeting where I explained the process, reassured them that this was not intended to cut more positions, but was intended to identify opportunities, possible gaps in services and in staffing. That session was recorded so that anyone who couldn't attend had an opportunity to view it. So going into the project, we wanted everyone to have a level of comfort that they were able to provide me with frank input and feel that what they were saying would be incorporated into a report, not just, here's another survey that we're doing to see how happy you are or whatever.
Okay.
I did interview 52 of the 58 staff members. They had the opportunity to determine if they wanted them to be in person or virtual, if they wanted them to happen during their work hour, after work hours. So that was completely their choice on how they did that. The other thing that I did as part of this project is they just completed their 5-year strategic plan, and I reviewed that to see what were the priorities of that plan and how did they mesh with some of the things that came up in the interviews. So that was the process that I went through. So some of the general observations or things that came up a lot in my interviews was staff felt that there should be a focus on health equity, that is on the populations that are most in need, making sure that those people are getting services. Given that about 33% of the population in Kane County is Hispanic or Latino, the need for translation and interpreter services was identified as significant. The communication issue, both internally and externally, how the health department is viewed by the public, or what I heard a lot of is a lot of people in the county don't even know what the health department does. So the whole issue of branding and outreach came up. With respect to human resources, consistent staff onboarding and training and ongoing performance evaluations were raised as areas of concern and that needed to be improved. The increased resources, both in funding and staff, was identified, and then expanded and improved community partnership and collaborative activities. It was recognized that it is impossible for a single health department to provide all the services that a community or county needs, and that they would have to continue to build the partnerships that they had developed to provide those services. So these were some of the general things that came up.
Can I ask a question as you're going along? So I'm going to assume that the health department is more akin to the state's attorney's office than it and the coroner's office than it is, say, the sheriff's office, in as much as each municipality has a police department and then there's a sheriff's office for the outlying. The health department doesn't, do they or do they not? Does St. Charles have a health department? Does Geneva? Does West Dundee?
No.
Or similar to a coroner, the county acts as that role from south to north?
Correct.
Okay.
Correct. That's how it works. Yes. There are some other organizations that provide some of the services the health department doesn't. Aunt Martha's, the Visiting Nurses Association. Those are some of the organizations that services were contracted out to a while back. So they perform some of those services, but they're not public entities. They're not a public health department.
And if you can, just off the tip of your head, does anybody have any idea what the budget gross number for the health department is? And of that number, percentage wise, is 50% of it grant funded and 50% is tax funded?
I did not even look at the fiscal part of it, so I can't.
Okay.
I can't
Thank you
answer
for
that.
being
I don't
honest.
know if
Appreciate
anyone
that.
else has any.
I think that if I may, they have a substantial amount of grant funding.
Do me a favor, pull
Oh,
that closer.
There is a substantial amount of grant funding with that budget. And I
Percentage wise, can you define 25%, 75%?
no, not at 75,
50?
but I'd say anywhere from the 40 to maybe 55%
Okay.
category.
Okay, thank you so much, Madam Chair.
And that's
Mr.
not the case
Chairman,
across.
Shepro,
It's Mr. Shepro. Yes, I'm sorry.
Madam Chair.
Miss,
Go ahead, Ken. Ken, go ahead.
the city of Elgin does have a health department that's a division of its community and neighborhood services,
Oh, interesting.
but it does not have the same type of jurisdiction as our health department. But for
Okay.
example, my recollection is that Elgin does its own like restaurant inspections
Oh,
and
okay.
does not use the Kane County Health Department.
Ken, thank you for that information. Valuable as always.
And Aurora might be similar, I'm not sure.
I don't know. I didn't
I
hear
don't, I
that.
don't think so. For the Green Fest, we had to use the Kane County for inspections.
Okay.
Mavis, thank you.
I think that the state requires the county health department do inspections. So there may be another layer that a city does. I don't know that for sure.
And they also do
Another
well
oddity-
inspections, the county.
Ken, let's chime in and stay in decorum here. So,
Sorry,
Well
yeah.
inspections.
pardon me?
Well, to make sure that the wells are safe.
Drinking water.
Wells,
Yes.
just, yes. the
Okay.
private
Wells, not
wells.
like wellness.
No,
Wells. in the
wells.
Groundwater
Water.
wells. Got it.
Yes.
Yes.
Septic, tanning salons, lead prevention. There's a whole range of other than food that they do inspections on.
Got it.
Okay, great. So I took those general observations and I tried to mesh them with what the strategic plan said, what the priorities were there. And so what I identified here is of those major things that were identified as general issues or observations, all of them are somehow being addressed in that strategic plan that just came out, which was a really positive thing that I saw on my part. There's a good connection between issues that the department has and the things that their leadership team has identified as priorities and they have set goals for. So those things I talked about in the previous slide are all addressed in the 5 strategic priorities in their plan.
Were you satisfied identifying an issue and having a methodology to take action on those? Were you satisfied that there was a methodology there?
They actually identified goals and measurements for each of the
Okay.
priorities and then broke the priorities into subcategories and had measurable outcomes for each of those as well.
So measurable or actionable?
Both actionable because they listed some activities by year and then identified how they would measure those activities.
Perfect.
So
Thank you so
both.
much.
So what I did next was look at, in terms of staffing, what were the needs to provide the current services in the most efficient and effective way for each of the divisions. So the Health Protection Division is the division that we were just talking about that handles, food, sanitation inspections, well, septic, tanning, property maintenance issues. They do the surveillance for West Nile, for ticks, the bat surveillance, lead prevention. They do also track all of the communicable diseases and report on that. And then they also do education on chronic diseases. So that department has a pretty broad, or that division within the health department has a pretty broad scope. What I did was I broke the staffing recommendations into 2 levels. Those that I called priority 1, which were things that there was an immediate need for. And then the priority 2 would be a lower level need. So I'm going to talk mostly about the priority 1 level, but we'll give you a little bit of information on the level 2. So in the Health Protection Division, there are currently 9 environmental health practitioners. Those are the staff that go out and do the actual inspections. There has not been a change in staffing in this division and of the environmental health practitioners in the last 10 years. But the number of restaurants and the number of well and septic inspections that have to be done have gone up over the last 10 years. About 15% increase, according to the state, in restaurants and accommodation facilities over the last 10 years. In addition, last year, the Illinois Department of Public Health increased the requirements for those inspections, which means they take longer, there's more paperwork, and they have to do more follow-up. So there's been some changes that warrant some staffing increases there.
Might I ask if, it's one thing to say that we've increased the number of boxes that need to be checked, but has technology helped reduce the amount of time it takes to check those boxes?
Unfortunately, and that was one of the things that came out in a lot of my interviews, is the technology that the health department is using is not sufficient for what they need. So they're still doing paper applications for inspections. It's not online as it is in a lot of other departments. All of their documents are in paper, and then they have to translate them to computerized format. So there has not been any efficiencies in that.
I have
area.
limited exposure to the health department. But as a booster club, high school booster club chair, believe me, on a Friday night when you're waiting for before your concession stand can open, and you know that you're number 14 in line for all the other football teams and you're at the north end, that person becomes increasingly important for
Right,
that.
right.
And then we listen to the builders that are all saying, I couldn't get my permit for that. And I'm just like, it takes 9 months to build a house, 4 months to build a house. Really? When did you turn it in for your inspection for
Mhm.
your well?
Mhm.
I mean, I think there's things that technology wise, we're probably due for an overhaul there that would help them enormously. And but I don't know the cost benefit analysis of
Mhm.
that at all.
Yeah,
So,
and I didn't do any
Okay.
cost benefit on that. In
but your
fact,
hunch is the same as mine. They need some attention from an IT perspective.
from both, yeah,
Yep.
they need a staffing, just because physically they have to go out and do them.
Right.
So even if technology helps with the paperwork piece of it, they still physically have to go out and inspect 1, 2, or 3 times a year, depending on the kind of facility,
Absolutely.
that kind of thing. One of the things that I should mention is all of these staffing recommendations do have funding implications. The staff and the leadership in the health department recognize that. And that's one of the things that they know needs to be analyzed. What is this going to cost? And how would you pay for those kinds of things? So these are just the recommendations. There's not any funding ideas attached to it.
But was it your perspective at all, and I'm sorry to ask so many questions,
That's
but
okay.
was it your perspective at all that there was any amount of the recent ARPA funds that could be available to help them? And did they have their ducks in a row to get those as our portal opens? Do they understand what their technology challenges are and have that plan set forth, or are they not even there yet?
No,
Like, how can we
I can
help?
tell you.
How can we help?
One specific thing that I know they identified and has been a concern of theirs is the ability to provide on-site services, like a mobile service for vaccinations, for testing, for outreach. They did put in an ARPA request for a mobile van
Okay.
that they could do that. So I know that happened. So my guess is they've looked at some of their other things in addition to that. That's just the one that comes to mind.
Super.
Okay. Lead risk inspector, they currently have one. And there was a change with the CDC's requirements in the last year that acceptable lead levels used to be a 5.0 milliliter per whatever. That's not my area. So, and it dropped to 3.5, which means that there's an increase in the number of facilities that they're going to have to address because of lead issues. And the communities in Kane County do have a high level of lead pipes. In fact, I put in the report, I think it's Aurora is the second highest in the state in terms of lead
So
pipes.
again, is that one person we have supervisory over all of the municipalities that are testing their own? Or is that one person expected to go test every community?
My understanding is that they have the mandate to do all of the lead testing.
I don't know how one person's doing that, so.
Mhm. And then, given the increased requirements in both lead testing and inspections, an administrative assistant to support the paperwork tracking, that kind of stuff. On the priority level 2, a health educator, one of the mandates of this division is to provide chronic disease outreach and prevention. And so a health educator to do that would significantly add to their ability to provide those kinds of services. Right now, it's kind of on an ad hoc basis. If a supervisor has a request to go out and do an outreach event, they can do it, but there's not someone designated to do those. And then with respect to communicable disease, I believe there's a 3/4 time person. There are 80 reportable communicable diseases that the federal government requires you provide information on. That one person just can't do it anymore with the data collection, analysis, and reporting requirements that there are. So that's the Health Protection Division.
Someone have a
please?
question?
Yeah, thank you.
Could
Did
you
you
state
say-
your name and chime in?
Mavis Bates, thank you.
Thank you.
I have a question. I just want to clarify. Did you say Aurora has the second biggest lead risk in the state or something?
Hang
like
on,
that?
let me look in the report because I actually put that, let's see.
Now you stepped in it. Go ahead. Mavis, we'll take that offline and get back.
Okay, thank you.
Okay?
City of Aurora is the second in Illinois and the highest number of lead service lines. That was according to a study done by the Metropolitan Planning Council in November of 2020.
Okay, thank you. Second
Yeah.
highest service. line.
Lead
Thank you.
service lines, so lead pipes, basically.
Thank you. I'm probably sitting.
Mavis,
on
if you
one.
work hard, you can get to number 1. So,
And I mean, we have to remember that like in older communities, that's pretty common
Uh-huh.
and those things haven't changed. You
these are
know, it takes
river,
time
these are
to,
river towns with buildings that are over 100
100
years old. That
right.
infrastructure is
Yeah.
dated and we have to
Mhm.
be cognizant of that.
Yeah.
So
Thank you.
Sure. Under disease prevention, this is the division that does the TB clinic, does immunizations, the Kane Cares program, which is for first-time mothers, low-income mothers to help with their childcare development needs and healthcare needs. This also includes the high-risk infant follow-up program, which is the program that addresses high-risk infants from premature births, birth defects, low birth weight. So that's what this division does. And again, I broke it into 2 categories. Most of your nursing staff, your public health nursing staff falls in this division. So the recommendation is additional RNs for immunization and TB clinic. Those would be cross-trained nurses because of the fluctuations in immunizations and in TB. You don't know, you may not need 3 nurses in TB at any given time, but you may need them in immunization. So the ability to transfer back and forth is important. Currently, the wait time for an immunization is 4 to 10 weeks. So in order to get that wait time down so that residents can actually get immunizations in a timely fashion, you need more staff there.
if so we don't leave that dangling.
Mhm.
Are we the only place in town where you can get that immunization?
No, there are other places.
So why would somebody go to the county as their primary place versus going to their doctor or going to a clinic, or was that identified at all? or-
It wasn't, it
Okay.
really wasn't, yeah.
To me,
But a
it's
lot of people don't have a primary care
okay,
physician. So
and
that's
where I'm trying
one
to
of the
get to.
reasons. that-
Where's that threshold that makes the divide? And in this particular arena, we're on this slide, and we're on slide 6 of 9. So in this arena that we're looking at, as a healthcare executive, I can only tell you that the cry of, and the plight of we need to find nurses does not fall on deaf ears. We are in a time, a snapshot in history where there just flat out aren't enough people to satisfy the need. And he with the biggest wallet wins.
That's right.
And so we can't, our company can't compete with the national companies that can write the $10,000 bonus check.
Mhm.
As a county, I don't believe that we can compete with a hospital that offers a package that we can't hope to get to. What we can do is manage it and manage those expectations to the very best of our ability.
And what I heard from, especially from the nurses that work in this program, is nurses that work in public health do so because they have a passion for providing services to the residents of their community. And that was evident with your nursing staff here. They are here, and you have a lot of long-term nurses. They are here because they believe in what they do. Pay is important in order to keep new nurses here. One of the things I heard over and over again, not just in nursing, but across the board, is we are a great training ground for other organizations.
It's-
People come, they stay 2 years, they get their time, and they leave. Turnover is expensive.
The
And
acquisition
so,
cost to get somebody on is, and Dave, I'm coming right to you, is unbelievable. And the other thing that, I mean, the other thing that I see on a regular basis with this is along with passion comes burnout. And you can only sustain that level of performance for so long before you say, I need a beach. And the question is, do you need a 10-day beach or a 2-year beach?
right, right.
What's your recharge on this? And I don't ever want to report back that we're naive to that. We get it. And it's
Yeah,
not
you're-
all about the money. It is about their calling, but there is a burnout factor, and you can have the best conviction in the world, but
Yeah, your high-risk infant follow-up nurse, you have one. She has 300 people on her caseload right now.
that's unbelievable.
Yeah.
Dave, you had a question?
Yeah, thank you for recognizing me. I'm not on your committee, but I do have a question. I want,
You're very
Clar-
handsome. It's hard
What's
not
that?
to. You're handsome. It's hard not to
Thank you.
recognize. Yeah.
I do have a question for clarification. Did you say 4 to 10 weeks to get a shot in your arm?
I did.
And is that only recently, like, let's just say during this COVID age, or is that
I
common?
don't know that. I asked what the turnaround time is. Right now, it's 4 to 10 weeks.
Because I think that's an important thing to know as we consider keeping the Kane Vac site open.
But if that vac site only does COVID, my question is, if you're paying somebody to sit there, could that person be doing other things, other vaccines, other flu shots? You know what I mean?
You
And-
do have a medical reserve corps too that has been helping with your vaccine clinics. So, and that's really expanded in the last 18 months. So you've got those people to call on.
But Dave, even if you can keep the site open, you still have to staff it.
I
That's the
understand.
tough part.
Understand, and my only point would be in my thinking of this recent information is that when we close the Kane Vac site with the recommendation that people can then go to the health department to get their shot, they're already waiting 4 to 10 weeks to get a shot.
I
So
understood.
just my comment, my
Mhm.
thought.
Troublemaker, thank you.
Um,
Someone has a question?
oh, yeah, Louis.
Hi, Louis.
Hey, how are you? Just a quickie. So I used to go to the VNA to get my TB shots. And the reason I did it there was because they used to be quicker and faster and right down the road from me, instead of going to my regular doctor. And so I was really shocked by this wait time now also. Haven't used it recently. However, I do know that most people, especially in Aurora, use the VNA clinic. And there's actually a VNA that's at the East Aurora High School, and then there's the main one, and there's another one. So I know that that's where most people in Aurora at least would go.
Anita, is that TB for your volunteer services?
Of course it is. You get it too.
Anita is a wonderful volunteer in our prison systems and is required a TB test
TB,
every year. And I just,
mhm.
as long as she's chiming in, I'll embarrass her and acknowledge.
Well, you get the same shot for the same reason, so, I'll embarrass you right back.
Thank you.
We're
So
two
the-
people that enjoy going to jail, so thank you.
The next RN is in the high-risk infant follow-up. I told you that you have one nurse there who handles 300 patients. She covers the whole county. The Kane Cares program, there is a large number of children 0 to 6 who are eligible for this program, about 15,000 in the county. Even if you wanted to serve 10%, you don't have the staffing. This recommendation would just replace a nurse that grant funding was eliminated and so lost a staff there. The lead program, I mentioned the change in that, the standards in the communities that have high lead levels. And then if these staffing changes were made, a public health associate would be needed to schedule and do intake for the immunizations and TB. Somebody has to get all that paperwork done. On the priority level 2 side, generally an administrative assistant to help with billing if there's increased clients coming in to do that billing, RNs for outreach. And then it was also suggested that it would be beneficial to have a nurse practitioner. A way to cut some costs would be to have this be a clinical site for nurse practitioner students. So you'd be able to do that. Some general recommendations with respect to staffing, bilingual interpreter or translator. This isn't tied to any specific position, and neither is the bilingual RNs, but just across the board to bring in and put an emphasis on bilingual staff because of the large Hispanic Latino population here in the county. The issue of outreach and branding was kind of exacerbated during the COVID pandemic because the staff realized that there aren't a lot of people who know who the health department is. They don't have a good outreach mechanism. Their website isn't user-friendly, so people can find the services they need. So this was an area that there needed to be some kind of staffing new staffing implementation there. And then the wage and salary review, I know that the County Human Resources Department is moving down that path, and that was something that the staff recognized. None of this could happen without having some kind of review of the wage and salary. In the full report, I give you an idea of how your salaries for some of the critical positions compare to salaries just generally in the Chicago metro region in the state, and you're significantly lower.
Pat, you are unfortunately coming after some very heated discussions over the past few months and quantifying some information for us, which I think we all suspected, and we thank you so much. But one of the processes that we just completed was the reapportionment map, which was very sensitive to some of our Latinx communities, which we identified as a small pocket in Carpentersville, a large pocket in Elgin and Aurora. Do we have health facilities in each of those 3 areas, or how do those
Yeah, I'm going to talk
pockets
about
identified get
facilities.
to? Yeah.
Yeah, can I hold that question?
Yes, ma'am.
One of my last slides is about the buildings and facilities, and we
perfect.
talked about that a little bit.
Madam Chair, 1 second.
Excuse me, Pat, just to follow up with what you said was brought to my attention yesterday in regards to websites, social media, et cetera, public information, that the Kane County Health Department has an answering machine you call up, and they direct people to a website that you could go see. Well, the website .org was one that they had bought like 15 years ago, and I apparently failed to make payment on it. So it was directed to a broker, just said you can have this site if you want to buy it. And it's actually, the website is Kane County Health, whatever it may be, .com. is the one that is being paid for. So when that was discovered, that was immediately repaired. But this is the kind of devil in the details, the deep dive that has to go through so that there's correct phone numbers, there's correct phone links, that people are responding to phone calls.
Well, and even in terms of the referrals, because, you know, the staff recognizes they can't do everything and they're going to make referrals. But in order for someone to get to the right person to get that referral, the website isn't very user-friendly, was what was shared with me.
We all agree.
So that's the staffing piece of it. I did also probe with staff about additional or future services. They had a big laundry list, and this is just some of the things they identified. We did not get deep into additional services because it was uniformly recognized that there needs to be some kind of comprehensive community assessment or evaluation to determine specifically what services need to be offered, how much of those services, who else is doing them, and then what are the resource needs for those services. So in order to do pregnancy testing, is that a need? Would people
Tough to look
use it?
forward when you're at capacity and treading water.
Right, right. So without,
This is a noble list, but
without more analysis and really looking at what's the mix of services you want to offer, how much is it going to cost, what are the staffing requirements for that, and how long is it going to take you to get to full implementation? These things are things that would be important to look at, but there needs to be more analysis there. The other thing that needs to happen is some kind of prioritization. What are the most critical ones? Can you start with one or two things to delve into and then move down the list?
Pat, we're pushing almost a quarter till.
Last slide.
Perfect.
Yep. This was just generally the building or facility issues that came up. You asked about location. The Aurora location is good for the southern part of the county, but transportation's an issue for people in Elgin and in Carpentersville. There is not enough space in either of the facilities. There's a small facility in Elgin and then the large one in Aurora. Most staff are doubled up in offices, in very small offices that also have lots of boxes and because they don't have storage space. Confidentiality is a problem because there are multiple staff in an office and the offices are small, oftentimes just kind of cubicle spaces. There is limited clinical space, which impacts the ability to provide immunizations and TB and all that stuff. And then just some general building issues. I don't know if you've been over there. The building is not the most appealing place in the world. The cleanliness and appearance of the building leaves a lot to be desired. The layout of the building has created a lot of siloing between divisions. So one department is on the left side of the basement and the other is on the right side of the first floor. And so there's not a lot of coordination in between staff. In the Elgin office, there's layout issues. They don't have any water in their space. They have to go into the hall to, use water and that kind of stuff. So there are building issues. I know that's something also that's being addressed here in the county, but those were just some of the things that came up. I wanted to make sure I
Thank you so
raised
much.
issues. That's all I have. There is a lot more detail in the full report, and I would be happy to provide you with anything else you want with respect to this.
Pat, I fear that we're not done with you. So at risk of not going super granular, let's bring it around the horn. Anita, do you have any questions?
No, I'm good. You did a really, really nice job with the presentation and kind of condensing it all. Unfortunately, it certainly brings to light a lot of things that we have been neglecting, and a lot of that due to the COVID outbreak. But we really have to get back on a lot of things, I guess. So thank you.
Perfect. Deb?
This is going to be an ongoing thing.
I agree. Mavis?
Yes, this is a long-term project and this is just opening up the lid of Pandora's box.
Mark?
Yeah, afraid so. That's, there's a lot of needs and always scarce dollars, so a lot of
Mo?
work to do.
Yeah, thank you for presentation. It's very educational. My question is, how does this committee relevant to this presentation? It looks like it is a Department of Health, Public Health, and I think that committee is the most relevant to address these issues.
Mo, that's a great statement and a wonderful question. And I believe HR, Human Services will at some point be handing this off.
Next week, we'll
Okay.
have their committee meeting.
And we are more than happy to work hand in hand and help facilitate wherever we need to. But I don't see this being a handoff in its entirety. I see it being a continued partnership between the two committees, between the two departments, so we can achieve this. And this is just step one. If I'm mistaken on that, Jamie or Pat, let me know. But I think this is the preliminary step. So, Ken, do you have anything? Or Madam Chair?
Thank you for the time. I
So
know I
very,
took up
very
a
much
lot
for
of your
everything
time.
you've done, and we appreciate it. And before we move on, Ms. Gums, are you on?
I'm on. How are you?
Yes, that statement about Dave, I mean,
Oh, yeah. Well, it is what it is, right?
okay. Business analysis update, Jamie.
I'm just going to give you a brief update, let you know we're still working on the RFP to pick a consultant. So a consultant hasn't been chosen yet. We're kind of hung up on, we're getting job descriptions from all the departments and making sure there's alignment between the job descriptions, the org charts, and then the payroll system to make sure that we have consistency across all of those. So we are working directly with each department. We have had excellent cooperation from all of our departments in getting all of this organized and squared away. So I just wanted to give you a quick update and let you know we are still hard working on it every day,
The
and it's moving
Herculean
forward.
task. It
It is.
truly
It's a big
is.
project.
And just so if I'm not mistaken, there were two departments that were reluctant to assist. Have they been assisting or at least getting you what you needed?
Two departments have declined to participate, and they are offices of elected officials. And if they decline, then they decline.
Okay, thank
That
you.
would be the Recorder's Office and the Regional Office of Education have declined to participate.
Okay. Jamie, thank you so much for staying on top of that. It's so appreciated. Ethics ordinance, Vincent, straight from court, ran right over here. We appreciate your hustle.
Not a problem. So the update on the ethics ordinance, as you remember, we were working on the Lobby Registration Act, and there's a bill that is going into effect starting January of next year. I was looking at that and put together a draft of that lobby registration ordinance. I brought hard copies here. I can also disperse it electronically for those who are not.
Let me ask you the sequential question. Do we put ours in effect before that law is in, or do you need this sandbagged until that law is in and then we layer ours?
I would wait until that law is into effect, but I'm just dispersing them today for a hope to have a discussion on the next committee meeting. By that time, that law will be in effect. So,
okay, under the notion that we are stronger together than our separate parts. Mo, are you on top of looking at this, and are you and Vince hooked up?
Yes, I got the draft yesterday. I looked at it. I had a very minor, picked up a couple of typos and here and there. So I can send mine back. My suggestion would be that every committee person should get it right now and start looking at it.
that sounds good.
I would like to receive that draft that Mr. Benson has.
Okay, it's just so I'm clear on this, who will coordinate getting that out? The state's attorney's office or the Human Services Department?
I can send out the draft copy to the committee.
So if you send it out, that means we're all sending it back to you.
And, not to reply all, but individually, if whoever has comments or questions, individually reach out to me and I can take those. Yes.
Not going around the horn, but as a group, is there consensus on this? Is this okay with everyone?
Sure.
Yes.
Okay.
Yes.
Mr.
Vincent,
Chairman,
thank you so very
Shepro.
much.
Thank you.
Appreciate it.
Mr. Chairman, Shepro,
Yes, sir.
I'd just like to make sure that I got a copy as well as an ex officio member.
Yes.
Thank
I
you.
will send a copy.
Wait,
to both
Madam Chair, is that you're asking for a copy as well? Yeah, Vince, make sure everybody on the top of the header for this committee is getting
Will
that.
do. Thank you.
Okay, thank you so much. Michelle, look at how nice Vincent and I are playing. We're really doing, okay. Internal controls, Jamie.
Well, this was put in on the agenda at the request of the committee last month when we were having a discussion around, there was some conversation around internal controls and you kind of said, let's kind of talk about this next month. You know, as far as internal controls go with our elected officials, they do have.
Describe what internal controls mean. Give us a broader brush.
So an elected official has authority to control the inner workings of their office, and then the county board would you know, set the budget for them to work within, but the decisions within their office are entirely their own, so they have autonomy within their office. As long as they are compliant with the law. That's really the only requirement on them. They do have to maintain compliance with any legal requirements. But other than that, they have their own authority within their office.
And which offices, so we're being very specific on this, which offices conduct themselves under internal control?
Any office that is headed by an elected official, such as the sheriff's office, the state's attorney's office, the recorder, the treasurer, the auditor, really any office that is headed by an elected official.
Okay, so being the caveman of the group that throws rocks, my understanding, I get very confused with this from the perspective of their budget comes from us.
Yes.
But what they do with that budget afterwards is entirely theirs.
Yes.
Am I
Mr.
even
Chairman,
close on that? Mr. Shepro, let her answer that question, then we'll come to you.
yeah.
Then. Am I, all we do is approve a budget.
I'll let the state's attorney probably be a little more specific on that.
Nice handoff.
So there, with most things, there's some nuances there. We do have some summaries of internal controls we can distribute to the committee if they would like. I think it might be something that goes beyond, I'm not prepared to list everything today.
No.
But yeah, generally speaking, officers with internal control all of their employees. They make their employment policies. They have say over what goes on in their office in general. And then obviously there's nuances and competing issues.
So I believe that if I can just set a tone on this, I think that when you have somebody in charge of a department or an elected position that's been there for years and years and years, there's a certain pattern of behavior that people come to expect. And if a new person is elected, their interpretation of internal controls might be different, not better or worse, just different. And some of those are being challenged to some degree, such as the coroner's office doesn't need to have our health insurance if they don't want to. They could get their own. The state's attorney's office could go with a different plan for this. They don't need their own. Just because they're in this building doesn't mean they couldn't be in a different building. And some of those are being challenged back through this committee. And I just want to make sure that we're understanding the limitations between each and that we're playing as cards up as we can, because I think that at least for me, who's only been doing this for 3 years, I'm making assumptions. I'm not going off of facts. I'm asking questions, not giving answers. And so when somebody challenges or makes a internal control statement, I just want to make sure that we're all understanding exactly what that means and playing by one set of rules. So Jamie, am I even remotely close on what I'm trying to articulate?
Yeah, I think that makes complete sense. One thing that I think I mentioned last time was there are some programs, like you were mentioning, that elected officials choose to participate in that are county funded, such as health insurance is a good example. And that if the elected office wants to participate in the county's health insurance and benefits offerings, then they can actually adopt the county's health insurance policies. So there's a couple of them, like we have healthcare continuation coverage for retirees, insurance benefits, and employee assistance program, deferred compensation. Those are all county funded programs for benefits for employees that have a policy written around them. So the employee handbook that the county board has adopted really only applies to the county employees that are under the county board's jurisdiction. The elected officials can adopt the county's policy handbook, or they can have their own. And several of them do actually have their own that they operate under. There's other.
And Jamie, before you go on, just so we're clear, that doesn't make it bad. It's just different. If a department or an elected official's staff decides to go in direction B instead of direction A, it's not a wrong direction. It's just a different direction. And that stigma of, well, why aren't you doing it the way everybody else does it? Well, if we just do the same old thing the same old way, and so, but within a tolerance, because I do believe that there's a what's the financial term I'm looking for? There's a, if more people are doing it, the benefit is greater than if you try and do it individually on your own. And you know, I believe our buying power as a collective is stronger. And so some of those differing might not.
Economy of scale, I think you're looking for. Cliff.
Yeah, exactly.
Like a group buy,
Pardon me, Mavis?
a group buy.
Yeah, correct. Scale of economy, Mark. Thank you for missing that. I'm sorry,
Mr. Chairman.
Yes, Mr. Shepro.
Yeah, if you would permit me to just weigh in on a couple of the things that have been said. As State's Attorney Neerman has stated, there are many nuances to it, but some of the things are more significant than others. I believe that, for example, the statute says that the sheriff and I think the coroner are required to use the county procurement system. Others do not have to, but most do. I think the comment was made by you that, and it's correct, that the elected officials can agree to participate in any program or office that the county board is willing to let them do that. But as you also pointed out, if there's a change of official, they can decide they're not going to do that anymore. You may recall there have been examples where some departments were moved around depending on, the sheriff took over for a while. The sheriff ran the 911 board completely. The other comment I wanted to make is I believe with respect to personnel hiring, I think every elected official could probably start their own personnel department and not use ours, but I don't think anybody does that. With respect to budget authority, I think the summary was accurate. I think there is either a court case or an opinion floating around from the past that indicates that while the county board has the budget authority, it can only specify 3 broad categories. I think it's like personnel, commodities, and capital. And so, although you will see a budget that's got individual line items, the elected official actually has pretty much carte blanche to shift around within those line items, as long as they don't go over their overall budget. And I guess the last comment on this is this is a system that's been in place since the 1840s, 1850s. And it only works well if everybody wants to try to work together. If those of the more senior board members will remember the fight with the Miss Seiler when she was the circuit clerk. A lot of those areas are gray areas. There's not a lot of cases on classes like that. And usually there are egregious cases like cutting the elected officials' budget to, $5,000 or something. So.
And if I can cap
Yeah.
you there, I think Michelle Neerman has pointed out, there's lots of gray areas in this.
Yes.
And I think the point of the discussion is clearly to say that, while different people will, while a group of people might have differing ideas on this, I don't think that there's any content station in this at all. And I think that we're all working together to try and make this happen. But just because somebody might exercise their internal control muscle doesn't make it a bad thing. They absolutely have that privilege to do it. But we might want to point out to them that there's, there's a certain economy of scale that works to our benefit to hang together. And I don't think, and I think that should be acknowledged.
Yeah, I guess I would say that it isn't always a bad thing, but it often is.
Yes. So, Jamie, unless we have anything else on that, I mean, I think we're, and does any other committee member have a comment on that? Or are we okay just leaving this and not returning it to an agenda item? Was the discussion ample?
Does anyone have any further questions for me on it or?
Oh, that's
Perfect.
fine.
Thank you so much. Okay, we're moving on to, Jamie, stay up there. We're moving on to Resolution E, amending the tuition reimbursement policy in the Personnel Policy Handbook. Blair, can you bring that one up? Jamie, walk us through.
The changes were sent out. There's a number of changes versus the old policy in here, and there is a track changes version. Did anyone have any questions on it initially, or do you want me to go through and point out them all? There's quite a few, and we talked about a lot of them last time. One of the big changes here is providing a definition to what would be tuition subject to this policy. And then the board also asked for a training policy to specify use of training funds, which is actually the next policy. So that's really your major change. Among some of the other changes that the board was discussing, or the committee was discussing last time was, if you go down to the guidelines, raising the maximum, making the program more accessible by allowing students to defer with the school, changing the time to submit your reimbursement from 12 months to 3 months. Those are really just functional to try to make it more accessible.
So Jamie, if I may, we were making, at the committee level, we were making a segregation between tuition reimbursement and training.
Correct.
Okay, and this is just the tuition reimbursement side.
Mhm.
Is it prepaid or after successful completion?
It's a reimbursement plan, so it's after successful completion with a grade of C or better.
And what is the maximum amount that any one individual can get for one submission?
The maximum is $2,400 per fiscal year and up to 80% of their tuition for the course. And that's tuition only, not including books, fees.
And who is
or other
required
things.
to sign off on this?
This policy has it such that the human.
I'm sorry, who is, if you were a student, if you will, asking for the reimbursement, who does that individual employee go to for approval?
This would go through human resources, and then human resources is work with the supervisors or department heads associated to make sure that the classes are work-related or related to the county work in some way to help further their career within the county.
And will that be transparent to this committee on a monthly basis, if will we see a listing of who is applying? And again, I don't think we need to know granular. I think that needs to be I don't think this is a HIPAA thing, but I mean, I would think it's right akin to it.
There is a tuition reimbursement report with the financial reports each month.
Okay.
So, and the way tuition reimbursement currently works and will continue to work is they apply first for approval and then they get reimbursement after completion of the course. And we do monitor the budget. And if we do run out of funding, then we would stop approving requests.
And where does that funding come from at this time?
The riverboat money
Not taxpayer money.
is not taxpayer money. It's riverboat funded.
Committee members, does anybody have any question for Jamie on this resolution?
I have a
Question,
Yes, Ken.
defer debates.
Bates, question.
Oh, okay. I would like this to be a little different. For
How so?
example, well, I think there will be some employees who can't afford to pay up front. And I'd like to see there be a way that we would pay up front, maybe as a loan or something to the employees, because I think that's part of equity, is to make this so that the employee doesn't have to have that money up front.
Mavis, my challenge on that might be that if we upfront the money and the employee doesn't pass the class, what do you do with that?
Well, then it could be a loan.
I don't know how to administer that. And I think
I
you're,
think you have a very good point, Cliff. And I think there's probably ways to get around it that I'm not, you know.
I agree with you.
experienced
I'm just trying to think it through. Jamie?
In order to, one thing we did try to do to increase that equity, recognizing that issue, was to allow the employee to defer with the school. So if the school will allow them to hold that payment, that would be an option for them.
Oh, you're good.
I mean, they would pay afterwards?
Yes, they would pay after completion of the course if the school would permit that deferral. The policy previously stated that the balance had to be paid in full before we would do reimbursement. But if the student can defer with the school and the school will issue them a grade, then we would allow that. That was just the effort to increase that equity.
Mavis, would that satisfy you?
Well, I've got another question. Do schools do that? I've never heard of a school doing that.
I think their financial aid office, yeah. Ken,
Okay.
you had a question?
Yeah, well, I had a comment. I did to the Mavis's and your comment. I mean, if you, the record keeping, additional record keeping that would be required to be determining what constituted financial need, I suggest you talk to the supervisor of assessments about what's required, for example, to get the senior freeze. And it's a very intrusive, lengthy process to determine whether somebody qualifies for that financial assistance. But my question was, is there a lifetime cap in addition to an annual cap?
I don't know the answer to that, Jamie.
We do have a lifetime. If you scroll up a page for me, Blair. We had a cap, a lifetime cap of, I'm trying to remember what it used to be. To change it, I believe the first suggestion was to change it to 19,600 as a lifetime cap, and that would enable people to get an associate's degree. There was also talk about removing the cap completely, and I got comments from board members also to remove the cap completely. So that's really a choice for the committee to make, whether you want to retain a lifetime cap or you want to remove the lifetime cap. So that's part of the
Where is that outlined, the lifetime cap?
Do you want to scroll down? I think the red line version was included in the packet. That would include, so in the comments, I talk about the lifetime. Let me see what page it's on here. I can't read that.
And if that was your question, that's an excellent question. I did not have that on my list. I apologize.
Yeah, that was my question, because I think there was, at one time anyway, a lifetime cap. But
We are collectively stronger, my friend. Thank you. If that's not in here, I suggest,
It is, if you go to page 60 of the packet, the lifetime maximum used to be $9,600. And it was a suggestion of Commissioner Lewis to change that lifetime or to remove that lifetime cap.
so removed in its
so-
entirety?
Yes.
I would, sir,
None of them. Yes, ma'am.
I think that's a good idea. Let's leave this more open-ended.
Jeffro, I was going to
More
ask,
flexible.
somebody mentioned a 19,000 number and I wondered where that number came from.
That was in the previous version, and I actually think it might have been Commissioner Bates who had suggested that in a previous version. And then the comments came back to remove it completely then in the next version, because we've been reviewing this over the last several months.
So-
That number came from an estimate of the cost of an associate's degree.
So this is Lewis. Yeah, I was the one who put in the recommendation to remove it. Because $9,000 or even 19, if the employee is with the district, or I'm sorry, the county, so let's say they're with them 20 years and they have moved up along and now they're into the point where they're going for a master's, we would not be, with a $9,000 cap, we would not be able to help them at all. So while I understand that, we can't, spend unlimited amount of money, I think that we have to be flexible in helping our people grow because that's part of maintaining them. Keeping them.
Madam Chair, I
employed.
see you. Let me make one comment. My only concern about this is, this isn't our money. This comes from the riverboat money. So I don't know how big that pot is. And my assumption is there's only $50,000 in there. So are we saying that only one person could ever access this, or do we want a cap on it so that more people could access those funds? I know, I'm not sure I'm saying that correctly, but,
There still would be a $2,400 per year cap.
okay,
So the cap would be per year, but rather than giving them a lifetime maximum, you would encourage ongoing education by removing the lifetime max and retaining the $2,400 annual maximum per employee.
okay. Madam Chair,
I was just.
Tavis with
following-
a question comment also.
let's go with Corinne first.
Following
Yeah,
up,
well-
so someone could continue on after their associates and get their bachelor's, which is highly appropriate. But then we would encourage people to go on and whatever that tuition may be for graduate degrees, including master's, MBA, doctorate. Would that be all included with that, or does it not matter?
It wouldn't matter as long as they continue to be a county employee and they continue to pursue education that's relevant to county employment.
To their specific job?
It can be for another job within the county that's currently allowable. For example, we actually have a lot of people that utilize it that may be an administrative assistant that wants to become a probation officer. So that education might not be relevant to their position as administrative assistant, but is toward their career goal of being a probation officer within King County.
And
Bring it on.
if I can, while I have the microphone, there's earlier on in the description, there was the description for clarity between tuition, academic tuition versus training, and it defined it as capabilities. At first glance, I found that somewhat confusing and not specific enough of what we're actually looking at, because we don't want, if we have a separate training proposal on how we define training, but yet we're using training in tuition reimbursement.
I'm not following that because
Oh,
tuition reimbursement is very specific for.
But it does say training on the original one that you showed us. So you have to scroll back up. I believe it was on the first page. And it was in caps and highlighted, underlined. Policy under definitions. There it is. Education includes any form of instruction or training that improves or develops capabilities of an individual.
Jamie, at this point, I'm going to say, why don't we move this why don't we not call this today and tighten this up a little bit? And I mean, unless it's just that one word.
Well, that does come directly from the IRS statute, that quote.
And you just got trumped. So.
Or did I get Biden?
Yeah, you did. I'm sorry. Oh, that was good. If that's the IRS language, then I don't think we have a.
Okay.
But I believe the intent here is two very specific things. So somebody is going on for a degree is different than, hey, I'm in the IT department and Microsoft just came out with a new thing and I need to be credentialized for that or certified for that. Those are two separate game plans.
Would it be possible, just so that future boards can see where this language is coming from? Could we qualify that even just to quotes, Department of Treasury and cite the, just
Include a
cite it?
reference. You
Yeah.
can add a
Michelle,
reference.
is that a nod yes or a no? That can't happen.
No, it's actually at the header of the policy. And then we reference section 127 of the Internal Revenue Code there as well.
Okay.
Scroll down to the red line version. That's got the header on it.
This kind of segues to my question, Cliff.
Go ahead, Mark.
So
I-
we put in there the CFR sites, Code of Federal Regulation sites. And then in the first paragraph, we do reference section 127 of the.
I think those quotes,
Internal
Fred
Revenue
Flintstone
Code.
this enough for me to,
think so.
yes, I, you know.
Okay, very good.
Mark, go
Thank you.
ahead.
Just looking for
It's just,
clarity.
for me, kind of a threshold question, I think. I mean, I was taught many years ago, you know, if you had a task in front of you, you'd write an outline. And the very first step of your outline was, what is the purpose? So what our threshold question here, I believe, is what is our purpose here? We can describe these things, we can have definitions, we can talk about tuition reimbursement and training and within your own scope of work currently or future desire. We as the policymakers and you know, providers of the financial assistance, what's our purpose here? Is it to serve as many people as possible from this shrinking pot of money, which is unfortunately what riverboat funds have been? Is it to provide people with the opportunity to take the odd class here and there? Or are we really saying we want to help you get a degree? Because I think if we kind of address that threshold question of what our intention is with this program, it will help guide us in the direction that we ultimately go.
Mark, my intention is employee retention.
Okay.
You know, the acquisition cost of a new employee continues to rise. And, you know, we have some of the best and brightest, but we've cultivated them. You know, those are in-house. We didn't just go out and pilfer them from someplace else. And just for me personally, I believe having something like this continues that bullpen, if you will.
Right. No, and I think that's a great strategy. Mine wasn't to argue or advocate one way or the other. It was to do what you just did, which is let's identify what's our goal.
So
What's
do you
our
need, are
purpose
you
here?
suggesting you need that statement inside the resolution?
Well, as Madam Chair just, you know, alluded to, future boards will at some point have to look at this and try to understand what were they trying to accomplish? Why do we have this? Where is it going? So any of that can be included for clarity, because it won't always be you and me or Madam Chairman, it'll be future boards can look at it and say, okay, here's what they were trying to accomplish. Does it still do that or not? So any language that can be added that describes where we're trying to go with it, I think is useful.
Do we have the ability to move this out of this committee to the next committee and add that blurb in between? Or do we need to keep this at this committee until the blurb is added before we move it on?
Well, we do have that policy statement, that first paragraph, which is what we added to the policy in hopes to do what Mr. Davis is suggesting. But if you don't agree with that, the way it's written, we certainly can modify it, and we can modify it between committees, or you know, you can modify it here and still move it on if you all want to do that. But that initial policy statement, do you want me to read it aloud or?
No, I would like to move this from committee to the next committee with the understanding that we will include a short line talking about employee retention.
Okay.
Mr. Chairman, Shepro,
Yes, Mr. Shepro.
To Mr. Davis' point, and perhaps to yours, and I apologize, I had to step away for a minute, so maybe I missed this. Is there a difference between tuition reimbursement, or if you are going to seek a degree, do you have to submit that up front? Or what happens if you take a series of courses which eventually add up to the degree requirements, but there was no plan at the outset to do that? Is that something that is addressed or needs to be addressed? And as part of that question, again, if I missed it, I apologize. Is this essentially a first come, first serve as long as the funding is there? And
You are correct in your later statement. It is first come, first serve.
And depending on the other purposes for which we're doing this, is that fair? But the consequence of not having it be that way is then someone would have to determine who's got a better need or a better proposal for what appears to be a shrinking amount of money every year. And so the last point I would make there to bring it around is, given the goal, it's great to set all these guidelines and parameters, but if the amount of money is so limited that it makes it functionally impossible or very difficult to actually fulfill those, as the poor would one or two people soak up all the money in a particular year, then I think the goal of improving morale through and employee retention is almost dead on arrival.
To address your first question, employees are required to provide a training plan. So that would include what their goals are and the programs that they're enrolling in to achieve those goals. And that would be something that Human Resources would evaluate along with their supervisor or department staff as to the effectiveness of that plan that they have, and would be a part of the approval process. As far as all of the money being used up, our current funding for this is $50,000 a year. And at a $2,400 per employee maximum, that would get you nearly 21 employees able to participate each year. In recent years, we have not exhausted that money, which, for any number of reasons that may change going forward. So, I can't promise you what the future will bring, but in past years, we have not exhausted that 50,000. And 21 employees isn't a lot compared to our 1,300, but it's been sufficient so far.
One comment.
It's 25 after. Keep going, Ken.
Yeah, I know. Well, okay. But yeah, the word training program, our plan was just used. And that makes me nervous because one of the reasons why you're doing this is, what is the difference between training and tuition reimbursement? And I just would caution that we have to be very careful how and where we use the word training, or we're just going to either increase or exacerbate the confusion that might have already existed.
Mark, I'd accept a motion to table this to the next meeting.
Postpone.
Postpone.
I'll make that motion.
Deb,
to
thank you so
postpone.
much. Do I have a
Sorry.
second?
Second, Davis.
Okay,
Bates second.
perfect. Let's call a roll to postpone this to the next meeting. Jamie, do you have enough notes to refine this?
Yes, sir.
Perfect.
Allen,
Allen, aye.
Bates,
Bates, aye.
Davis,
Davis, yes.
Iqbal,
Iqbal, yes.
Kenyon, Lewis.
Lewis left.
Oh, sorry. Sturgis.
Sturgis, yes. And Jamie, I'm almost suggesting that we take this next one and postpone this as well.
Yes,
Let's
I'd
do these
suggest
as
it's a part of
collective.
the same conversation.
And Deb, could I have that same motion for this, for item F?
Yes, Mr. Chairman.
Mark,
I
would
move
you
to
second that?
postpone.
Sure.
I'll second.
It's not on there's no resolution with it. So I mean, I guess we
It
can
was
just
just a
defer. it.
discussion.
Correct.
item.
Let's bring these together because to separate them is going to cause confusion. So
Sure.
call the roll too.
Allen,
Allen, I.
Bates,
Bates, aye.
Davis,
Davis, yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Surges.
Jamie, item number 9A, resolution amending the 2022 fiscal year budget to roll over funds for the business analysis project.
This is just a housekeeping resolution. The $30,000 that was budgeted for the support of the business analysis has not been used, and we just want to use it in fiscal year 22.
Davis
Allen
moves.
moves. Allen
Davis
seconds.
moves, Allen seconds. Any discussion? Please call the roll.
Allen,
Allen, I.
Bates,
Bates, aye.
Davis,
Davis, yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Surges.
Surges, yes. Item 9B, I believe, Jamie, if I can surmise this, we had a bump up in the insurance afterward. There's two things that happened after we approved the insurance. The first one was there was some conversation as to whether the multi-use building was added or not. It was added. There was no adjustment required, and added from a builder's risk package to a permanent package. The second one was when all the premiums came in for the $2 billion, blah, blah, there was a $6,000 offset that we need to adjust for. Am I correct in that?
Correct.
Mark? was the
Davis
motion.
moves.
Allen seconds.
Alan seconds. Any questions? Please call the roll.
Allen,
Allen, I.
Bates,
Bates, aye.
Davis,
Davis, yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Surges.
Surges, yes.
Passes.
Item 9C, Executive Director of Human Resources position. A week ago, 2 weeks ago, we posted the position for a full week. We received 20 to 22 candidates for the position. We have a committee of Surges, Leonard, Davis, Fonstock, and Onzik, representing the chair and two previous chairs of the committee and the two departments that interface most with human resources. That committee met last week and I'm so sorry, and Madam Chair, by all means. That committee met last week and we narrowed the field. Our goal was to narrow to 3 candidates that was concentric amongst the group. To our delight, we have 6 candidates that we are interviewing tomorrow morning, beginning at 11, going through 4:30 in the afternoon. We expect to be able to come out of that with our final 2, which we will debate amongst ourselves, and if need be, have a secondary interview with them before we bring that information back to, I don't believe we're going back to committee, Madam Chair. Did we agree that this was going straight to the board after that?
I don't think we had, I don't remember that discussion in the process.
Okay.
It should probably go to the board.
The goal is to have the hire completed at the first meeting in January. To achieve that goal, I believe the instructions we were given was that the committee, the hiring committee can bring that directly to the board for concurrence. Madam Chair?
This, Mike, we may, as a courtesy, want to go into executive session very briefly to introduce the final candidate to the admin or to the executive committee before it goes in, just so that they're aware of who this individual is before we actually go to the board.
So that would not be today, right now?
Oh, absolutely
Absolutely
not.
not. Okay. Correct. So any questions on that, how that search and how that process is going? Seeing none. Okay, I get a motion to place reports on file.
So moved. Davis.
Allen seconds.
Alan second, there we go. Any conversation on this, discussion? Please call the roll. Let's go with Kenyon and Davis as second.
Sounds good.
Allen,
Allen, I.
Bates,
Bates, aye.
Davis,
Davis, yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Surges.
Yes.
Passes.
Item 11, executive session if needed, release of closed session minutes. Do we have any closed session minutes at this time? Is there an urgency for that? We're at 10:30. Okay, wait, we have a state's attorney who has raised their hand.
The Open Meetings Act requires that each committee review their minutes semi-annually given the nature of the pandemic and then remote meetings and so forth. We have been unable to do that for quite some time. In light of the number of the makeup of the board who's here in person as opposed to remote means makes it a little bit difficult in any event. So I would leave it up to the chairman whether or not you want to defer it till next month, but in any event, we're here and ready.
You
to
have
go.
been waiting here for an hour and a half.
Yeah.
Do you want us to do this now? Or is it better when we have more people in person for you to hand these out to?
If I
There's only
could-
2 of us in the room.
If I could at least ask for a closed session just to talk about it very briefly, I would appreciate that. I would promise to be done in less than 2 minutes and 50 seconds.
Mark, did I just hear you
That's
motion
very
to go to
precise.
executive session?
I move that we go to executive session to
Wait,
discuss the
second.
release of closed session
Wait,
minutes.
Wait, second.
Call the roll for executive session. Sorry to the committee behind us.
Allen,
Allen, I.
Bates,
Bates, aye.
Davis,
Davis, yes.
Iqbal,
Iqbal, yes.
Kenyon. Surges.
Surges, yes.
Passes.
Call roll for open session, please.
Allen,
Allen, present.
Bates,
Bates, present.
Davis,
Davis here.
Iqbal,
Iqbal, present.
Kenyon.
Here.
Lewis,
Not here.
Surges,
Surges here.
Shepro,
Shepro here.
Pirog. Here. Thank you.
Mr. Kenyon, do I have a motion?
I'd like to move we adjourn.
Davis, second.
All in favor?
Aye.
Aye.
Ladies and gentlemen, thank you so much. I apologize for the length of the meeting.
It was hard but good, Cliff.